I'd like to welcome to the program Dr. Robert Roush, Jr., Professor of Geriatrics, Department of Medicine, Huffington Center on Aging, Baylor College of Medicine, Houston, Texas. Bob, welcome.
Glad to be here, David.
Excellent. So I invited you to come on and talk with us because I know you've done studies and done research in the area of financial exploitation, especially the health impact. So give us a little bit of background so we can dig into this subject a little deeper.
I'll be glad to. David, in 2009, we received a grant from the Investor Protection Trust, the nonprofit in Washington, D.C., to train healthcare professionals on the fact that their older patients may be vulnerable to financial exploitation through no fault of their own. There's a neurobiological underpinning of all of this stuff that happens to us as we age. Some people are more vulnerable than others. For example, mild cognitive impairment, which is almost a normal age-related change. It doesn't necessarily go into dementia, but people with MCI, and about 40% of everybody 75 to about 85 have MCI. They can do a lot of things that they used to could do, but they make 4 times the financial errors than those who don't have this condition. People with Parkinson's disease have a certain form of dementia associated with that. All these neurobiological, neurodegenerative rather, diseases, dementia, Alzheimer's, all these types of things. And it's just a really sad commentary on the fact that as we age, sometimes these things happen in our brains, and it makes us more vulnerable to financial fraud.
Yeah, and that's really, you know, at the very time people should be getting care, they actually can become a victim, a target of financial scams and exploitation.
So we teach the doctors and the social workers and the nurses and physician assistants, anybody that sees an older patient in a healthcare setting, to look out for things like self-neglect, which is a change in their appearance. Look out for social isolation following bereavement, loss of a spouse, things like that. Look for the MCI a little bit if you can. You can delve into, ask a few leading questions. We teach them how to use a little 3-minute test called the mini-cog that's pretty easy to use.
You're not going to do that with me, are you?
Oh, no. Okay. You'll pass. But if the mini-cog and other assessments would raise the level of suspicion in the mind's eye of a clinician that further testing needs to be done, then we refer them to other people that can do that for us. If fraud has already occurred, and it has happened many, many times, then we teach the physicians how to report these to the Texas State Securities Board. For example, in Texas where we live, every state has the counterpart to the Securities and Exchange Commission, and they'll look into it. And doctors did not know that before we started doing this in 2009. We're now in 32 states, had 15,000 physicians that have taken this course, and we're finding a lot of financial exploitation.